stress and anxiety issue, there is a query here suggests medicines for anxiety related to palpitation, and also clubbing that with the menopause. What can be the general strategy, therapies, and herbs and medicines?
See, in order to overcome such type of anxiety, I would suggest them to go with Brahmi Taila Shirodhara. That is one of the important thing what they could do it. But only thing is that when our outside atmosphere is cloudy, rainy season, or even excessive of winter and lot of snow, that times are not sufficient. I mean, not ideal for the Shirodhara. That is the one thing. Other thing is that once again we are consuming Brahmi, Shankapushpi and such type of Medhya Rasayanas with counseling part of it. Definitely will reduce the stress in those patients. So there, the people of those age group with menopause, they tend to have a lot of issues with their even with their husbands, and even they got tensions with related with their body, and they got their own understanding, and now they are feeling there is a fear, and so many factors will come into play. That's the reason they are not gracefully accepting the old age. It is very natural that how the menarche has started. Menopause has to occur. That has to be that should be accepted. So if you are not accepting in the sense, then there is a problem.
Yes, sir. And children growing up and arguing with for every small thing can be stressful, sir. After Shirodhara, to ward off any threat of like kapha increase in the head and neck region, can mild dhumapana be a strategy after Shirodhara?
Yes, definitely. Definitely you can go with mild dhumapana with haridra and gugulu.
Yes, sir. And regarding the anxiety-related palpitation, we need to be careful careful to evaluate whether it's coming out of heart or out of mind, right, sir?
Definitely, we need to check even the blood pressure over there, and we need to understand where there is any peripheral resistance. If it is there, then avoiding the salt and making the person to walk a little bit and all these things. And definitely, there are sort of a total protocol has to be followed. It's not by simple one herb we can change the things.
How do you rate this Manasamitra Vatakam, sir? I mean, it has become kind of my favorite anti-stress, anti-depression, anxiety medicine. Contains Swarnabasma if we go with like the pricey ones like Kotakal. How do you evaluate it, sir?
But this is Manasamitra Vataka cannot be consumed daily for a long run. It cannot be, and it can be used in where there is a comparatively a severe nature of stress or a severe nature of problems like autism or something like that. Then I suggest in those areas it can be. As for just to overcome the stress, we have got a better drug like Saraswatarista. It's comparatively better. Brahmi Gruta, that is much better. We have got sufficient drugs like even Ashwagandha, I mean, with Brahmi Gruta and Ashwagandha Kshirapaka, Estimadu Kshirapaka. These are all sufficiently gives nourishment to the brain.
And somebody has written like thyroid and adrenal issues also cause anxiety. And herbs like ashwagandha, they address both adrenal and thyroid issues as well. So kind of holistic aspect coming back again.